Good afternoon and welcome to today's program titled Delivering the Speed Patients Demand with Digital and Data Innovations. My name is Carol Davis and I'm an editor for Health Leaders and your moderator for today's event. Our program will be 60 minutes in length. Note that an on-demand version of this program will be available approximately one day after the completion of the event and can be accessed using the same login link that you used for the live program. Today's program is sponsored by EXL Health. Thank you to our sponsor and to you in our audience for giving us your time and attention. Before we get started, we have a few housekeeping details. To ensure that you can see all the content for the event, please maximize your event window and be sure to adjust your computer volume settings and/or PC speakers for optimal sound quality. Second, you will find today's presentation and other resources to interact with as downloadable items in the resources list. The resources list is in the upper right corner of your console player. Next, at the bottom of your console are multiple widgets you can use. To submit a question, click on the Q&A widget. It may be open already and appear on the left side of your screen. You may submit questions at any time during the presentation. However, please note that it is likely that your questions will not be answered until the Q&A portion of the program. Finally, should you experience any technical difficulties during today's program and need assistance, please click on the Help widget, which has a question mark icon and covers common technical issues. At this time, it is my pleasure to introduce today's speakers. We have Tina Azar, who is Vice President, Market Leadership for EXL Health, and Susan Wintersheimer, Vice President, Operations of EXL Health. Thank you both for taking the time to speak with us today. And with that, the audience is yours.
Well, thank you so much, Carol. We are really excited to speak with all of you today. Today, we hope to cover just a little bit more about EXL Health. We're also going to share patients' demand for their care journey and benefits to patients and providers on digital solutions. We're also going to share how to gain speed by streamlining your processes. And lastly, why digital solutions provides long-term investment returns. My name is Tina Azar, and I'm the Vice President of Market Leadership at EXL Health. My areas of responsibility include working to ensure that EXL designs and executes comprehensive and innovative programs that really fit the needs of the industry. I do that by analyzing healthcare trends, insights, and policies. Along with me is my co-presenter today, Susan Wintersheimer. Susan is the Vice President of Clinical Operations at EXL. She has over 25 years of global healthcare experience, having spent her entire career in care management, working in the payer and provider side, as well as technical settings. Now, for those of you that might not know or be familiar with EXL, we're a global organization founded in 1999, and our health sector started in 2015. And today, we have over 33,000 employees nationwide. We believe in using our deep domain expertise with analytical insights, as well as technology-enabled services to transform how care is delivered, managed, and paid. Today, we have over 800 customers. We work with payers, providers, PBMs, life science groups, employer groups, brokers. Really, our goal is to enable a better patient and member experience that improves quality and efficiency across case management, utilization management, and population health. We also provide comprehensive initiatives to help payers and providers with cost controls, reducing all over health claim expenditure while really working to help optimize revenue opportunities. We're also always keeping an eye on how we can improve the patient experience. So Susan's going to speak to how data innovations and services helps to service the patient's need for efficiency and reliable tools in their care journey.
Thank you, Tina. Hi, everybody. This is Susan Wintersheimer. As Carol and Tina mentioned, I'm Vice President of Clinical Services at EXL, and I'm going to talk about areas. First, patients' demand for speed. Second, how providers and payers are experiencing that demand. And third, how digital solutions can help respond to patients' demand for speed. So let's start with patients' demand for speed. In today's world, people expect to do everything on a computer or a smartphone screen, from ordering food and clothes, to buying and sending gifts, to managing personal finances. It's all done online. Most people have disconnected their home phones, and for those that still have one, they don't answer it. So no matter what's needed, people expect to accomplish it electronically, and healthcare is no exception. As a matter of fact, if you do a fast search on available healthcare apps, you get more than 300,000 returns. And COVID has significantly increased the options and frequency consumers seek to actually receive care virtually. In a national survey of nearly 2,000 healthcare consumers, 89% indicated that COVID-19 made telehealth, and I quote, an indispensable part of the healthcare system, with 65% planning to use telehealth even more after the pandemic. And this shift to digital occurs in healthcare. Patients are also demanding access to data about them. For example, patients want to see the data from devices they may use, things like glucose monitors or heart rate monitors. And access to that information empowers consumers to understand the data, variability linked to their own behaviors, and more effectively understand and use that data to manage their own health and conditions. So how are providers and payers affected by consumers' demand for digital tools and speed? Fortunately, the use of digital tools seems to be reducing costs for both consumers and healthcare organizations. For example, digital tools that enable consumers to conduct administrative transactions and access services online meet consumer need while also cutting operational costs for healthcare organizations. Digital health apps are also reducing the cost of care as consumers use the apps for things like health and wellness activities, diabetes management and prevention, asthma management, cardiac rehab. It's estimated that tools guiding self-management could save the U.S. healthcare system as much as $7 billion a year. So the upshot for healthcare organizations is as more digital tools are introduced and used to manage patient care, consumers still want involvement and direction from healthcare professionals. Okay, next slide, please. So what are some of the digital solutions that fulfill patient demand for speed? While healthcare hasn't always been the first in market to adapt digital solutions, and even calling healthcare fast followers may be generous, patients do want to use the same tools they use to engage with others today. As a consumer, if I am accustomed to using some kind of scheduling app to make an appointment with my hairdresser, or a digital tool to check the symptoms of my sick pet and connect with my veterinarian, I also expect to be able to use similar tools when interacting with my doctor, therapist, or others from whom I may seek care. As a patient, I expect self-scheduling tools through apps and online tools. And that's because this is how the world works today and how patients want to interact and do it at their convenience at 9 p.m. at night, for example. As a patient, I'd also like to receive a text notification when my test results are back. I actually really don't want to receive a telephone call, or worse yet, have to remember to call in 3 to 5 days to get my results. What I would love is a text that tells me my results are available, and then I can click on a link and go see the results myself, or even have the ability to share them with people of my choosing, and maybe also have the immediate opportunity through a live chat or a discussion option or something like that to talk about the results. As a patient, and I mentioned this earlier, I'd also like to be able to see the information you have about me and the opportunity to add data. For example, maybe I wear a Fitbit and I want to add my daily step count or put in my blood glucose level or even add my food diary and know that everything you have about me is accurate and complete. And as a final example, as a patient, I would also appreciate anything you can do to help me take better care of myself. I like to receive texts when I need scheduled care, things like a mammography or a retinal eye exam. Or better yet, if you could schedule an appointment for me according to the preferences I've provided, along with provide me a digital tool in case I need to make any adjustments to times or days, that would work best of all. The reminders and automatic appointments may make me a more compliant patient, which in turn can translate to closed care gaps, better health, and lower expenditures. From a provider perspective, digital solutions help dedicate time to patient care. Providers want to stick to the business of providing high-quality patient care and be able to leverage digital solutions for operational and administrative services. Providers want to meet the healthcare needs of the patient while delivering the highest quality care possible. Providers also want to be accurately paid for their services and have ways to efficiently interact with payers, including providing clinical information and satisfying any requirements to meet care guidelines. As value-based care arrangements continue, providers also need the right digital tools to guide care, understand care gaps, and effectively leverage every patient touch point while also managing the financial aspect. Providers can leverage digital solutions to achieve all of these objectives. Although providers have come to accept authorizations, pre-certifications, referrals as mandatory steps to interact with health plans and be paid accurately, providers want options that integrate with their own EMR systems. And they don't really like having to do different things, such as accessing different portals or fax numbers and following different request processes, health plans. By using digital solutions, such as providing required clinical records electronically or using digital tools to extract exactly what clinical information is needed to meet a medical necessity guideline, there's an opportunity to modernize and improve the manual phone fax authorization request process. Also, there are digitally driven opportunities to transmit required information in alignment with things like inpatient census reports and ADT data, link that directly with EMR data again, providing information digitally and directly and helping to eliminate a lot of the back and forth required in today's authorization request process. Healthcare is complex, and patients expect information about them to be shared across their team of healthcare providers, while they are also getting help navigating across their team of healthcare providers. So for providers, digital solutions result in improved patient experiences with better outcome and lower costs, while also satisfying the patient demand for speed. So to summarize, how digital solutions can meet the needs of patients and providers, gone are the days of waiting weeks for authorizations or pre-certifications so that members can get the care they need. Members don't want to wait to get care. To enable that, it requires providers and payers to have digitally enabled utilization management services and processes. Faxes and 2-week turnaround times, they just don't cut it any longer. Instead, we need digital ways to connect all the components to enable fast approvals. Digital solutions are required to extract and send data directly from EMRs with automated applications of medical criteria and determinations at the time of request for providers. Patients don't want to repeat their entire situation or health history to each and every provider. They expect data to be shared and all the providers involved in their care to be aligned and coordinated from the time of their very first visit. Patients also value the touch point and check-ins to keep care on track. That is, as long as they are done the right way using the right tools, which don't involve phone calls, to an obsolete home phone number. It requires digital solutions that enable data to be readily available, shareable, and can be analyzed across all providers involved in a member's care. Digital solutions need to capture and aggregate data between providers and maintain an accurate, holistic patient view. The better the aggregation and presentation of holistic treatment variables, the better enabled, more timely and effective treatment, which ultimately improves outcomes and creates a more effective and positive patient experience. Patients also want help from their provider in coordinating care options, maximizing their health insurance benefits, and minimizing their out-of-pocket costs. They seek guidance from providers to help with network selections and rely on them for referrals for covered services. Patients are demanding more transparent pricing information from their providers in order to make more informed decisions about their health care and maximize their health care benefits. They want the highest quality care at the least expensive out-of-pocket cost for them. A recent poll demonstrated that 3/4 of patients look at price transparency ahead of accessing care, meaning that digital transformation is not only critical to the quality of care that patients receive, but it is critical to their economic decisions around care, and actually, if they go get care at all. To enable, that requires accurate network and benefit information, payment understanding, and data-driven referrals to minimize out-of-pocket costs for the member. And finally, digital solutions can help with the requirement for data insights to identify care gaps, compliance with recommendations of care, and proactive outreach, with, of course, the ultimate measure of digital effectiveness being to improve the health status and the overall care experience. So I'm going to hand it over to Tina now, who is going to talk about how streamlining payer-provider processes can help to gain speed. Tina, take it away.
Thanks, Susan. So to Susan's point, we're actually seeing where legislation is speaking to the consumer's need for digitization and where the broken economics of healthcare is only going to be able to be resolved through the adoption of data integration reform. 28 million Americans exhausted their savings during 2021 due to medical debt. 17% of us Gen Xers carry medical debt compared to millennials who are really riding the line at about 42%. Those millennials are coming into the healthcare system experiencing high deductible plans where those plans have really fostered their need to know the economical outcomes of care. The perspective of today's patient has changed. New patient mentality and public policy have created an environment where digital innovations are just no longer a luxury. They're no longer luxury attributes, but really minimum requirements for care. Case in point, 1 out of every 5 medical claims and 1 out of every 6 hospitalizations in the U.S. include a surprise bill, and they are the primary cause of medical debt. As most of you have seen, there's a lot of noise out there in the airwaves today around this issue. One of the complexities around it is that many states have laws enacted today that protect the consumer. So if you're a provider or a payer or a vendor in multiple states, managing those requirements can be quite difficult. Organizations are going to need to be armed with better digital tools to be able to do so. The No Surprise Act was signed into law and goes into effect January 1st, 2022. The largest impact of the law is that it removes the member from the equation and they can no longer be balance billed for those services. This new law applies to the individual group health plans as well as fully insured plans sold through the individual group markets, as well as self-funded plans and ERISA plans. The legislation will look for payers and providers to apply existing state laws first, so long as it meets the mandates of the federal act. And if no law is on the books, then the federal law will look to apply the QPA, which is the qualified payment amount. Now that QPA is generally the median of the contracted rate of the plan or issuer for the item or service in a geographic region. That QPA assignment amount remains just a little bit unclear. We're going to look for further guidance from CMS in October. But under this new law, a plan can deny a payment, file a claim, and then engage in open negotiations for about 30 days. And then it goes to the IDR, which is the Independent Dispute Resolution, to determine payment. The loser pays the IDR fees. We're estimating those are going to come in at about $1,000 per case, and the outcomes cannot be appealed or disputed. Under the No Surprise Act, plans are required to offer online tools and phone support to enable participants to compare cost-sharing amounts. And then separately, under the ACA, providers are required to offer machine-readable files on a public website covering in-network rates, out-of-network rates, allowed amounts, and prescription drug prices. So how do providers prepare for this legislation? We're going to get to that. But first, let me share just another area of digital speed needs, where the patients are demanding more transparent pricing from their providers in order to make more informed decisions about their health care. A recent poll demonstrated that 3/4 of patients look at price transparency ahead of accessing care, meaning that the digital transformation is not only critical to the quality of care that patients receive, but it's also critical to the economical decisions around care, and to Susan's point, if they get care at all. One of the largest issues is that debt can cause people to neglect medical issues. Nearly 1 in 3 Americans say that they've delayed getting care because they were worried about the cost. The price transparency rule also is soon into effect, and where that No Surprise Billing Act has really raised the most noise, this law is probably the most disputed, and where the provider community is digitally unprepared. Starting July 1st, 2022, both hospitals and insurers must reveal long confidential pricing data that includes the rates that insurers pay for services. It must contain underlying negotiated rates paid to healthcare providers, as well as historical information on charges and payments to the out-of-network providers. Now, I think many of you have probably seen this. There's a lot of noise out there about this article, what I'm putting here on the bottom of this slide. This is from the New York Times. Sarah Cliff, who's a preeminent healthcare reporter for the Times, published this article. And I would share that I believe it didn't fully express the complexity around this issue, right? So if you go out to this website, and if you haven't, I would highly encourage you to do so. But what you're going to see is really a scrolling script, right, that shows a long list of providers and then payer amounts paid, probably contractual amounts paid for a service. And the article really does not say anything about allowed amounts or contractual amounts, nor does it talk to how contracts are negotiated at a TCV level, right, or total contract value between a provider and a payer. And very little care is really given to the pricing of individual charges like a foot x-ray. It wasn't until the wide adoption of high deductible plans made the price differential so apparent that providers were painted in this pretty unfair light. So how does a health system or a provider prepare? We envision 6 digital segments where providers can really further their preparation. For the No Surprise Act and the Price Transparency Rule, we would encourage providers to partner with advisors and policy SMEs and service supports to help address the fluidity of the requirements while crafting a program that's going to design supports and help support the agile needs of the consumer. We also see that data analytics are going to help healthcare organizations address risk assessments for rate negotiations, as well as real-time rate sheet applications, along with suggested pricing models. For example, hospitals and health systems that offer bundled payments are going to fare much better underneath this new piece of legislation. For facility readiness, call center automation for high-risk events or member intervention, as well as outreach, will be needed. And in addition, staffers are going to have to know how to discuss pricing and patient financial responsibility. Providers should also be linking cost data with other important information sources, such as relevant and public reported quality or patient safety scores, which really help patients to identify high-valued services instead of just lower cost of healthcare. For RCM, revenue cycle management, having a real-time pricing strategy and a better revenue cycle management tool will become critical, as well as contract management and digitization tools. The truth is, the U.S. payment model is complex, and it's really set up to foster adversarial events between provider and payers. The sooner that we can get to a same source payment models, the better. Lastly, arbitration prevention and support resources will also probably come into play. So the bottom line, providers must open up the digital front door to a wholly connected patient journey, from registration to follow-up care, using technology and patient self-service tools. U.S. healthcare is shifting to consumerism. Customers expect to understand prices so they can make informed decisions around their care. With digital tools and data insights, providers are enabled to find value in those industry shifts. For example, looking at the industry today, we've got about $140 billion in unpaid medical bills from last year. That's all sitting at collections. What if the industry could prevent 1% of that? What is 1% of your organization's collections or unpaid debt? These changes will be the catalyst for payment reform and significantly reduce specialist revenue capture while forcing providers and payers to operate differently. Health systems and providers have to focus on how to attract those patients, and digitization is the backbone of that journey. We're also advising to watch out for vendors that are positioning products to appear as if they're consumer-friendly, or providing mock solutions that don't really meet the requirements of the law. Or worse yet, we've seen this recently as well, is just how to skirt around the requirements. Instead, look for cutting-edge pricing tools and facility consultation services. Reliable data and excellent consumer experiences are really minimum expectations. They are not product or service goals. Most importantly, we encourage organizations to really start the dialogue. Start talking about this within your own four walls. All right, so why do digital innovations help achieve long-term investments, or how can they? Let's give you an example. I'd like to call out Northwell Health as the example. This was recently published by Health Leaders, a great article. Northwell is a nonprofit integrated healthcare provider. They have about 23 hospitals, 830 outpatient facilities in the state of New York. And using AI, they were able to augment their post-discharge workflows in an effort to really better address non-clinical barriers to care and risk factors. And they did this successfully. It reduced their readmissions by over 23%. Healthcare is improving, and really good digital tools such as this and better use of data-driven insights are really going to help us all get there. All right, so that is really the information we wanted to cover today. So Carol, I'll turn it back over to you to see if we have any questions from the audience.
All right, well, thank you both once again for an excellent presentation. And this now brings us to the Q&A portion of the program. As a reminder, to submit a question, click on the Q&A widget at the bottom of your screen. It may be open already and appear on the left side of your screen. Please note that your questions will remain anonymous and will not be viewable by other audience members. So the first question we have for you all is, for patients, are you seeing different solutions required for different patient demographics? For example, we are primarily a Medicare provider, and a lot of our patients don't have cell phones.
Thanks, Carol. It's Susan. I can take that one, and then Tina, maybe chime in if you have some additional thoughts to add.
Sure.
First, that's really good insight. It is important to remember that consumer demands do vary by patient demographics, and how a 30-year-old wants to connect, I'm sure, is very different than how somebody in their 80s to connect with ongoing relationships. So I think what's important to remember around the difference in demographics is that it's important to have different channels. So it can't be, kind of an all or nothing, that there need to be different channels and different modalities to meet differing consumer demands and what might be most important for the member population that is older. For example, it may be that you can establish digital solutions for sharing data, appointments, test results, care plans, things like that, with a designated person of the patient's choice who might be involved in their care or be part of the team of people that is helping to coordinate care for them. So while the patient's preference may not be 100% digital, there are ways to leverage digital tools, especially around that sharing. So I do think it's good insight with that question in terms of having different channels and modalities to meet those differing kind of consumer demands.
Yeah, and I would just add, we are in a really strange time where there's such a very large differential between even how I access my technology, right, as a consumer, comparative to how my children do. And so that is a really hard bridge to straddle for providers today. And I agree with Susan that, helping find the rhythm to help serve both of those entities as we kind of come into a new age of technology is going to become critical. Carol?
All right, next question is, what kind of ROI have you seen on digital solutions you mentioned, such as interacting with health plans for referrals and authorizations?
Yeah, maybe same thing, Tina, if I get us started, and then you can chime in with
Sure.
any additional thoughts. Especially related to just the overall process of referrals and authorization. There's lots of room for improvement around this. I think that maybe healthcare alone is perpetuating the fax machine. So what we've measured is somewhere between 25 to 30% efficiency gains from digital enablement due to elimination of the manual handling, the decrease in calling, the tracking, the monitoring, and simply replacing some of that manual back and forth with good digital tools. Also using those digital tools, we've been able to see and measure up to a 60% decrease in turnaround times, so that members are able to get care faster and seek those approvals, or in some situations, if any kind of clarifications or additional clinical information might be required. So that although regulations vary by state, and those are set by the state regs along with accrediting and regulatory agencies, but it can be as long as 14 days in some states that you have to process those requests. We don't think that's fast enough, or that meets a patient's expectations. So with our digital solutions that we're seeing, we are seeing turnaround times that can be decreased, like I said, up to a 60% decrease from current manual processes to get turnaround times to as little as 1 day even. So Tina, anything to add around that?
I would just say, I think overall, the front end of a patient's journey, right, which is really, I think, of reception as well as a prior authorization process, right, is kind of falling a little bit behind in the proper assessment to understand what do facilities need to be able to step up to a new arena of technology, as well as answer the new mandates. The mandates also come with notice and disclosure requirements. And typically we're finding that at a facility level, we're just unprepared. And so I think really look at, having an opportunity to look at your facilities and understand, well, what are the skill sets, where are the gaps that we need to really help address that. You're going to find a lot of economical as well as patient care facility gains.
All right.
Yeah, I think that's right. Sorry, Carol, can I just maybe add to what Tina said also around looking for ways that you can digitally connect some of those different components. So I mentioned this earlier, but if there is, an inpatient stay in a facility involved, how can we leverage the data that's already collected around admission, discharge, and transfer, and actually eliminate the whole request process around that? So that if there is reporting done or data shared, can that initiate the request? Can we link it so that information is automatically extracted out of EMR systems and shared with payers? And that, better yet still, let's electronically or digitally apply those criteria, and that at the time we connect all those dots, an approval or simply a notification acknowledgement that, all criteria is met, and that we look for ways to digitally connect all those points, again, eliminating some of that manualness. That will only help bolster any kind of ROI.
All right.
All right. Sorry, Carol, back to you.
All right. Okay, thank you. Our next question from the audience is, how would you recommend we address the lack of digital literacy as well as healthcare literacy as a whole?
Yeah, maybe I'll take the first part of this. And I agree that there is a gap there, right? The new legislation that's coming out with the ACA Act, only 9% of Americans today are understanding that legislation and understanding that the impact of it. And these are pretty transformative, right? And so I'm really hoping that just starting the dialogue and really getting prepared for it, what we're really encouraging is to get onto the other side of understanding that, yep, the arena has changed, right? And once you get on the other side of that and you start looking for your organizational value, I think that's a big step so that we can start the dialogue. I would also say around these issues, I'm seeing a lot of feedback from the payer side of the equation. But providers really haven't hit the airwaves and really helped to kind of educate their customer, right? And so I would encourage them to do that as well. Susan?
Yeah, I do think it's a challenge. I think we're seeing gains around digital literacy, especially with consumers themselves, right? And I think that's going to pull the providers and payers and everybody else along simply as consumers start demanding more. So part of it, I think, you heard me say earlier, it would be generous to call healthcare kind of fast followers in this space. I think we tend to be in healthcare, maybe in that laggard kind of block instead. But I think what we're going to see is as the consumers embrace digital and the demand to increase speed, that we're going to have to improve our digital literacy to meet that in order to keep everything connected and be able to respond to that demand. So I think it's going to be a bit as a pull as consumers demand the speed that only digital solution and some of that digital literacy is going to be able to provide.
All right, our next question here is, pieces of the price transparency rule have been pushed back or are not being enforced today. How confident are you that this legislation is actually going to be implemented?
Yeah, I did see that the actual deployment of some of the pieces of legislation are delayed. And I'm also seeing where the enforcement of it is a little bit softer than how it's written today. But I think it's important to note that the legislation is really following the trends of the consumer, not the other way around, right? The consumer has changed. I have a few millennial children at home, and I have a few elementary school kids at home. And when I make a doctor's appointment, I go to my Rolodex. and when my millennial child, my adult child makes one, she goes to her phone. And she completes a review of that provider while she's waiting for her Uber. She's downloading your facility app from the App Store. She's looking to understand how easy is it to use. She's trying to schedule online with you to see how long she has to wait before she can get in. And she absolutely is looking to understand your billing practices and what it's going to cost her. If I were a provider, I would lead with that. I would build in service of that customer. She is your customer. So to answer the question, I do think that there's a slight delay. We might see some more give and take as we really get that deployed. But we're really encouraging adoption because we believe that's where the value is. Carol?
All right. Our next question is, how do CMS requirements help the patient to a shoppable market, given it does not represent what patients are going to owe with allowable and cost shares?
Yeah, that's absolutely true. So it's interesting really even seeing what CMS says to this point, right? So CMS agrees that meeting the mandates of the legislation does not provide a completely shoppable market for the patient. But really the goal is the enabling of the data analysts and fostering a private sector innovation to really boost that consumer shopping behaviors, right? So in essence, they're really looking to allow the secondary vendors to help create a consumer-centric market. So this is step one of what I believe is going to be a pretty transformative journey. Susan, anything you would add there?
No, nothing further from me, Tina. Thanks.
Mm-hmm. Carol?
All right, then. We have the question here. Where is the most critical area for health systems to start?
Yeah, with the legislation, I'll start with the legislation, and maybe, Susan, you can answer it from kind of just patient care journey. I think the first thing that you can do if you're coming to in sort of a green space or a white space is really consultation, right? I would absolutely be partnering with an advisory service, a SME, to really say, come in and really assess where are your gaps, where are you going to spend your resources? And, are those dollars being put to a proactive state, or are you attributing a majority of your dollars just to arbitration, right? How ready are your facilities to address things such as the disclosure notice, such as consent laws, right? That you're signing, the patient is waiving their rights to the law and giving consent. There's laws around that. So really staffers need to be prepared and aware. And so I would definitely start with a good consultation to understand where your gaps are in your data assessments as well as at a facility level. And then from there, I would say, your revenue cycle management and your payment posting, I would be really looking at that very closely. Right now the providers need more advanced tools, more digital tools in that arena so that we can kind of lift and shift the payment identification process further up the life cycle of that experience. Susan, how about from a clinical setting? What are your thoughts?
Yeah, I think a lot of the same points, Tina. And I would start with where are the biggest pain points, either in time, dollars, or resources. Dig in and understand more about why that is, why those are such pain points, and what kind of solutions could help digitize some of that. So it's a good place to start. There'd be immediate savings
especially from just a cost perspective, but then also that could lead to other opportunities as you can then start to connect things to where you start digitally, if that makes sense.
I think also looking at variability, so using data and analytics to help support what you said around assessments, but also, the identification of those opportunities and looking at variation and any kind of outliers. So that should also help guide, kind of where to get started, especially from a clinical perspective. Not so much where things align, but where they don't. That should help provide some direction in terms of a starting point.
Yeah. Yep.
Okay. All right, and with that, I want to thank Tina and Susan once again for an excellent presentation. I would also like to thank our sponsor, EXL Health, for making today's program possible. And finally, thank you to you in our audience for participating today. We hope you'll join us in the future for another Health Leaders webinar. This concludes today's presentation.